that we have served for so long. I speak here as a very proud Canadian. By all accounts, I am a very successful Canadian. I have 4 university degrees, taught in several universities and colleges in the United States as well as in Canada. I came to this country as an immigrant, and therefore you see that immigrants with some help can succeed, can do anything. I mean, they can do. We do services link as well as ISAP service link is language instruction for newcomers. And ISAP is our settlement program. And because of the funding cut, we're not going to be able to provide that service after March 31st, 2011. I would like to share with you that we have several other programs that will be in jeopardy if our CIC fund is going to be gone. These are crisis counseling. We have a seniors program, newcomer settlement program. We have started a women's and youth center, but we have not finished building the place for them. And we serve all kinds of people who have come from all over the world, including Albania, Afghanistan, Algeria, Bangladesh, Brazil, Bulgaria, China, Republic of the Congo, Cuba, Nicaragua, Mexico, Ethiopia, Eritrea, India, Iran, Iraq, Morocco, Sudan, Pakistan, Romania, Russia, Rwanda, Serbia, the Philippines, Thailand, Turkey, Ukraine, and Vietnam. Now, as a testimony to that, I'm going to ask to share my time with one of our former clients. Her name is Christina, and she is from Romania. She has benefited from our link program, and I would like her to say a few words to you. Christina, please.
My name is Christina. I came from Romania. I've been living in Canada for 7 years now. When I came here with my husband and my son, who was 3 years old at the time, we are very confused, disoriented, anxious. We had to face lots of challenges. Small challenges, big challenges, from humidity to fill out forms for a SIM card, health card, driver license. Some maybe funny now, but at the time was really challenging for us. So when we got enrolled to a link program at the Ethiopian Association, we started to build up our self-confidence through expanding our knowledge about Canadian society. They assisted us to make resumes, to get prepared for an interview. Even for my son was a big challenge, so they provide services to children through their daycare. So it was very good for my son as well, not only for us. They assisted me to get equivalency for my degrees. Right now, I guess my success and my husband's success right now, he is attending the Canadian College of Naturopath Medicine, is the result of being part of the Ethiopian Association and the program. And I really thank you for that.
So this is one of our success stories, but we have medical doctors, engineers, medical scientists. There is one, an Ethiopian who is serving McMaster University, and we have one here, our own president, I don't know where he is, Dr. Haile Fanta is another medical scientist. So the Ethiopian Association is serving Canada, and therefore we are not fighting for the survival of the organization simply because we want to protect our jobs, but it's because we want to serve Canada. We want to get that chance. Thank you so much.
Thank you. Again, I want to emphasize we're hoping to do a little bit of old-fashioned public education here today. We have a number of people that are here that are directly affected by the services. We hope not just the media, but some of the other folks here will take advantage to talk to them. So we're doing a short version, which is just to expose the problem, what we want people to know, and what we can do about it. And then we're also going to have people be able to speak hopefully over a longer period of time, and we hope we're going to hear a lot more, because it's that success that we're here to talk about today. Toronto can easily, the Toronto area, and I know that's important with people here from outside of Toronto proper, it's important that we don't take it for granted. I know from my time as education minister, the school system is a tremendous place where people come together and learn to work together and succeed, but the settlement agencies are a very underrated part of the glue that helps make Toronto such a success. And what we're here today is to say is that some of that is coming apart. Someone who knows that very well is not just because he's the GTA, or the Ontario Caucus chair for the opposition, but also the former Metro Chairman Alan Thompson, a member for Europe Southwest. Alan?
Thank you very much, Gerard, and thank you. I wonder if I could just have Marion Newer, just from the Community Action Resource Center. We're talking about action and follow-up. If Marion could just say a minute. Thanks.
Marion Newer, Community Action Resource Center. We're one of the affected agencies that's been cut 100% without warning. We also exceeded all of our targets by December of 2010, so there's still another 3 months to go in our contract, and we've already exceeded our targets. So this was a huge surprise to us, and our staff have worked exceedingly hard. As a group of agencies, a collective of agencies who've come together, and we so much appreciate the support of Gerard Kennedy and Alan Thomas and all of the other MPs who've helped us. We also have a great group of students who are working with us to develop a campaign. They are working completely free, their own time, and I know that some of them are here today, but I haven't yet connected with them. Many of them, the majority of them, are from newcomer communities themselves, although they're not users of our services. They've been very successful in their own lives. They graduated from college. We're sure that their parents benefited in earlier years from agencies such as ours. So they will be launching with us on February the 1st a campaign called reliant.ca. This is advance notice. It's not ready to go yet, but they wanted us to announce it. So please, if you can connect with them today, I know Asa is here and Andrew, and I don't know if any of the others are here. But please take the time to talk to them. We really appreciate the support of these young people who are working really hard on our behalf, and who really understand on a personal level the value of the services that we provide to our communities, because their parents got that help and they're now successful in their own lives. So thank you very much.
Thanks very much, Marion. I thought it was important for Marion to express the community-based nature of what we're talking about. We don't need to convince you, because you are part of a transformation of Canadian society that has been going on for generations. And all of a sudden we have reached a point where we thought that this was part of the culture of Canada, and we find that there's a government that has taken steps that obviously we are not operating on the same premises. There was no rational reason, there was no process of consultation that in a clinical sense was an analysis and a prognosis for action. There is no continuity, no bridging of those two processes. And that is what must be so frustrating to you. It is unbelievable to us. We have tried to get information from Mr. Kenny's office, from the government. We've written to the Prime Minister. We would like an inventory of the impact, the multiples of access that has been undermined. So what we're asking, and I'd like to thank Anna for allowing us to come here and to meet with you. Thank Gerard for taking the initiatives he has, and that we are looking for a strategic approach to reverse this decision. And we cannot do it alone. We are all in this together. And so we're going to try and, over the next few days, get a total inventory to analyze it in terms of where those cuts are, what and how they are going to undermine a service delivery system that is community-based and has served us so well. My plea on behalf of all of us is, let's work together, let's get our names on a list that we can keep each other up to date, because this is